Hi, good evening everyone. Hello, hello. I think we're going to make a start, if that's all right. So good evening. My name is Ben Roberts. I'm the Artistic Director of Brighton CCA, and on behalf of the University of Brighton, I would like to welcome you to the university and to this evening's programmes of talks on more culture, less medicine. So while you're here, I want to say a couple of very brief words about the new forthcoming CCA, because I think it's relevant to a lot of what we're going to be doing here, and also to the RSA's work and to what Brighton and Hove Council are doing with this project. So for those, hi, I'm about to explain that now. So for those of you who are not yet aware, Brighton CCA, or Centre for Contemporary Arts, is a major new cultural initiative at the University of Brighton. And events such as these will be a major focus in our programme, expanding on the discourse of the many ways in which arts can have an impact across disciplines, from policy making and research methodologies, as well as the different areas that knowledge can have an influence on arts practice. So with that in mind, I'd like to give you a very brief preview ahead of our launch in October and issue you all with an invitation. So Brighton CCA will be a new centre for contemporary arts based across the galleries and the theatre here at the University of Brighton School of Art. We will be presenting a new programme of contemporary visual arts, film, theatre, design and publishing, bringing artists of international standing to Brighton, commissioning new work and growing the university's contribution to the cultural life of the city. A large part of this programme will be events focusing on the value of making, the creative process and cross-disciplinary research projects. So we're working with partners and organisations across Brighton and around the world, but as a small team, we are not always able to keep as abreast of all the exciting research projects connecting culture across disciplines as we would perhaps like to. So if you do have thoughts or ideas about ways in which we could possibly support or collaborate on projects interweaving arts and research, thinking and engagement from any field really, we'd love to hear from you, so please do get in touch. So on October the 19th of this year, we will be launching the new programme, which will be free and open to all, with exhibitions in the galleries, film here in the theatre, a new residency programme for alumni in collaboration with the Marla Lewitt Studios in Italy, all interwoven with a public programme of artist talks, research presentations and events like this one and others across the course of the year. You're all invited to join us and to bring friends and family to help celebrate the launch of an exciting new project for Brighton. I hope to see you all there, but for now I will hand over to Claire and Alistair, who are going to make introductions for tonight's presentations, and I hope you enjoy the evening. Thank you.
Hello, it's good to be here. We've been looking forward to this event for quite some time, and it's wonderful to kind of see all of the diversity of folks who come into the room to have this conversation today. My name's Claire Doran. I'm from the RSA, which some of you may be familiar with, some of you may not be, so I thought I'd just give a brief introduction. The RSA is the acronym which for a very, very long name. We are the Royal Society for the Encouragements of Arts Manufacturers and oh gosh, commerce. There are also a lot of fellows in the room this evening, so they'll keep me accountable, thankfully. So the Royal Society of Arts, I have my notes here just so that I make sure I get it right. So we believe that society can be enriched through ideas and action. And supported by now 29,000 fellows, we share powerful ideas, carry out cutting-edge research, and build networks and opportunities for people to collaborate so that we can create a society where people can live flourishing and fulfilling lives. So it's exciting for us to be part of the conversation and to support the conversations that are happening this evening, which are very relevant to a lot of the kind of themes which are rising up in the Southeast and also within the RSA. I'll be in the back, kind of lurking by a computer, helping to document the conversation online. So we'll be using the hashtag #MoreCultureLessMedicine, and you can ask your questions there. But there's also a lot of folks who were on the wait list that unfortunately we weren't able to give of spots to tonight. So we'll be helping them to ask their questions and bring their voices into the room from the back. So if you have any questions, feel free to kind of grab me, and there are a number of fellows in the room, so you might run into someone during the networking later. Thanks.
So thank you very much to Ben and Claire for kicking the evening off. I'm Alistair Hill, and I'm Director of Public Health for Brighton and Hove, and I'm going to be chairing this evening. I'm going to introduce my panel as we go through the presentations in a few minutes' time. So I've got to start with a bit of housekeeping. So basically, the fire exit is over that side of the room, and you can see the signs, so just follow those out. There's no fire alarm planned for this evening. The toilets are back in the lobby where you came in as well. So I think those are the kind of the basics. As Claire said, we're using the hashtag for questions. So the one up, I think it's up and behind me, so hashtag more culture, less medicine. Has everyone got a sticker on? Basically, we want, so everyone can put their name on the sticker and just the things you might want to talk about when you're networking later. So please do that. We've also, every table should have a table host as well. So we're going to have some group discussions later. So can we just have every table host stand up so we kind of check that every table has one? Yeah. Yep. Yay. Okay, fantastic. The system works. That's brilliant. So now everyone knows who'll be chairing your conversation later. And also, I'd quite like to know a bit about who's in the room tonight. So we're just going to go through different sectors. So who is here from health and care sector? Please stand up now.
Health and care sector. Does that mean council?
Nope. Okay, that's probably about a quarter, isn't it? And who works in the arts? More. So they're winning. And at this point, I realize some people are going to be saying they're in more than one category. So basically, it's not an exact science. Community and voluntary sector other than health and arts. Anyone here from that? Great. Welcome. Anyone from the local authority who hasn't been in the above category? Yeah. Okay, we're down to the small numbers now. So who hasn't stood up yet? So everyone stood up. Do you want? And are you RSA or? Right. Comms. Okay, welcome. So we've got what a fantastic and diverse audience we have this evening. So I think, yeah, the cards. The other thing, everyone has got a card. So what we want you to do with the card is put down at some point in the evening your pledge and your details if you want them to be known to us. Name and email, but you don't have to put email. Basically, what you can commit to do based on what you've heard tonight to make Brighton and Hove a centre of excellence for arts and health. So, and when you go out, there's going to be a box by the outdoor, so you can put them there. And if you're happy to do it, I think there's going to be some filming of pledges in the networking afterwards as well. So please kind of fill in your card at an appropriate time. Okay. So I think we're on to the main panel discussions now, and I'm in the strange, as the chair, I'm in the strange position where I have to introduce myself because I'm kicking off first, but normal service will be resumed. So I'm Director of Public Health for Brighton and Hove, and my vision is that everyone in Brighton and Hove is going to have the best opportunity to live a healthy, happy and fulfilling life. Over the last century, our life expectancy has increased dramatically, but more recently, we're living more years in ill health. And 1 in 5 adults in Brighton and Hove have 2 or more long-term physical or mental health conditions. All this despite excellent clinical care, rapid advances in technology, and increasing expenditure on healthcare. It's not going to be possible to treat our way out of this problem, and we need to look for different approaches. So I wrote my annual report to ask, how can arts and creativity help to meet this challenge? So I don't have a beef with medicine. I respect the vital contribution that clinical medicine has in improving health. 10 years ago, it saved my life. I had meningitis, so I wasn't necessarily about more culture, less medicine at that point in time. And I'm very grateful to the compassionate clinicians and effective medicine. So I'm sure many of us could tell a similar story about themselves or their loved ones. But the evidence shows that just 20% of our outcomes around health and well-being come from health and care services. The biggest influences are factors such as early years, education, our communities, our friendships, our work, our environment, and our housing. I think there's now a compelling case that arts, culture, and creativity belong at the centre of that list as well. Arts-based approaches help people stay well, recover faster, manage their physical and mental health, and help them to experience a better quality of life. The arts help us to get active, get involved, and strengthen our communities. Whoever we are, wherever we live, and whatever age we are, the arts can help to provide meaning to our lives, which in turn makes us more resilient to stress and the threats to our health and well-being. So my report highlighted the benefits arts and creativity can have across the whole lifespan. For example, building resilience and self-belief in children and young people, supporting recovery from mental health or substance misuse problems, singing to improve lung health, preventing social isolation and falls in older people, improving dementia care, or helping people and their loved ones coming to terms with the end of life. Arts and creativity can support us all in starting, living, aging, and dying well. Although in some aspects we're becoming healthier, for example, heart disease rates are much lower than they were 20 years ago, this hasn't benefited everyone equally. For example, in Brighton and Hove, men in our most disadvantaged areas die a whole decade more than those in the most affluent, and for women, the gap is 6 years. But the gap in healthy life expectancy, the number of years we live in good health, is wider still than that. So that's a really important inequality and justice issue for the city. We also know that too often those with the greatest health needs have not benefited from arts provision, or are perhaps never even given the opportunity to develop a creative voice themselves. So an inclusive approach is absolutely essential within this agenda. Otherwise, actually, arts and health is at risk of increasing the health inequalities we're trying to tackle. So it's essential that arts and health is participatory rather than one-size-fits-all, a standardized pill. A common question asked in healthcare is, where's the evidence? That's a question we do need to address for the arts as well. There's always a good need for good evidence, and this must be a priority. However, there's lots out there. I would argue there's already sufficient evidence for us to be doing a lot more than we are currently to raise our ambitions around the extent of arts within healthcare and using arts and creative approaches to improve health in our communities. So I don't think we need to wait for more evidence to do more, but more evidence would be good for other areas as well. Finally, we're very lucky to have so many assets to build on in Brighton and Hove. Our creative communities, 2 universities, including the medical school and the art school, a vibrant third sector, and an innovative health and care sector. Our communities, artists, service commissioners, service providers can be working together to strengthen collective leadership, share skills and knowledge, expand the evidence base, and ensure an inclusive approach to benefit those that need it most. In doing this, I think Brighton are well on the way to become a centre of excellence for arts and health. Thank you.